Ketchup on your French fries, or is it ketchup plus mayo, or is it just mayo? Let me know in the comments. Oh no. PTSD coming back at you. There's a lot of triggers for PTSD, and it gets into a big long conversation about the appropriate treatment for it. But there are different medications that you can go on, as well as different types of behavioral and cognitive therapies that you can actually do that would help. Oh! We see it in movies sometimes, an airway put in by a straw or a pen. You can put a tube into the trachea right there, especially if there's swelling and you can't get a tube down somebody's throat. Yeah. Drinking your own blood or anybody's blood will make you nauseous. You can actually get elevated levels of iron in your blood.
Too much iron in your blood.
We see people who come in and have a hole in their eardrums due to pressure, due to an infection. Blood could come out because of a small blood vessel there. Typically, you actually have a communication in the back of your throat with your middle ear. That's why we get fluid in our ears when we're sick. We continue to suck.
It certainly does suck.
Oh, jeez. And you can actually have some abnormalities of eye movements actually when you put different fluids in the ear. There's definitely a reflex, depending if you put cold or hot fluid in an ear. Cold reflex is the most common. Oh! What? I've worked at a restaurant before, and those grills are hot. So it's like a 4th degree burn. It's so deep into the musculature, below all the fat tissues and the nerves. If their airway's intact and most of the structure's still there, you could survive, especially obviously if the brain's still intact. Oh, and everything blew up. Their skin is charred, dark in color, smoke. Yes, that does happen. And the biggest thing we worry about, somebody actually has soot and black smoke in the nose, around the mouth. You always worry about upper airway swelling and edema. Lumpy, oh my gosh, shaving in the car, texting in the car, talking on your phone, all these things that would distract you. Please do not do that. I see a lot of pedestrians hit by cars where people are just not paying attention. Oh, jeez. Oh my gosh. Oh man. So the moose just lacerated the major artery of the neck. So your carotid artery, you have one on the left and you have one on the right. Did a good job trying to compress it, but gotta pull over, gotta stop the car. Oh, what a good depiction. When you start dropping your blood, you're gonna get more pale. When we have somebody who's losing blood,
She's gushing blood.
the first place we actually check is the conjunctiva, the red bottom underneath of my eyelid. If you're losing blood, it actually turns quite pale, so you can actually kind of gauge where somebody's hemoglobin and hematocrit are. Getting crushed between two cars, and I've seen this many times, sadly, where people lose their limbs, they lose their life because of these type of injuries. Oh my gosh, just exploded.
Explodes.
And you have intestines everywhere, the eyeballs pop out, the eyeball is attached by your optic nerve, some small blood vessels, and then your major muscles of the eye. So there's a lot of things actually going on in the back of the eye. A little lower. Perfect. Don't get too close to the cage. Oh no! It's good to go to a zoo at times because their animals are ambassadors for the wildlife that's out there. A lot of times you can't just put these animals back into the wild because they've been bred in a zoo the whole time and they may not survive there.
Yar, it's not his fault he's a sissy.
Is that a blow dart? I wasn't expecting that. People get glass injuries all the time. Car accidents, you'll get glass in your hair, maybe a little bit in an abrasion. People who are walking barefoot and it gets embedded in the foot. Sometimes you have to go to the operating room to get it out because you actually need continuous x-ray so you know where it is. Oh my gosh. You can actually see probably the humerus. Could a human rip another human's arm off? Probably unlikely. It usually needs a lot more force, but you'd have to dislocate and rip up all the tissue. So really hard to do. Oh my gosh, just getting torn apart. Where'd the dart go? Oh my gosh. Ophthalmologists actually do injections directly right into the sclera, which is the white part of the eye, for conditions such as macular degeneration to actually help. Uh-oh. We actually see this with the EpiPen. Epinephrine, use it in situations such as anaphylactic reaction. You want to take it and jam it into your thigh, but people may not notice which direction it is, and they'll inject it straight into their thumb, because most of the time people will put a thumb on the top and... What is this? What? A clone of himself coming out of like a plant or something?
I'm your clone.
What? The arm is gone. I love the perfect symmetrical circle that is always depicted. It always looks like a piece of ham to me. Of the upper arm, there is only one bone there, so that could be accurate, and major blood vessels will actually kind of run under through the armpit underneath the bone. Run away! Run away! Oh my gosh, this... Oh my gosh. People spray insecticides, pesticides over the farm. They'll actually use a plane to spread the material. How detrimental are they to a human being when they're also killing insects and bugs and all these other creatures? Yep. I love that the intestines, heart, and kidney all just come flying out. Yet no. We do have bad viruses that potentially cause like hemorrhagic like issues, but you just start bleeding out from everywhere. Nice. What's gonna happen? Oh, a seizure? A seizure could be brought on by many things. Most common things are missing seizure medications, lack of sleep, stress, substance use. Those are the big ones that would bring on a seizure outside of like head injury, masses in the brain, bleeding in the brain. Strokes can even do that as well. Bite block, okay. Don't put anything in your mouth. You can have your finger bitten off. You could have them start choking on whatever you put in their mouth. Typically what you'll end up doing is roll the individual to their side and put padding underneath their head so they don't bang their head. Oh, and falling off stage. Oh my gosh. We're seeing brain and we're seeing the red stuff right at where your mouth is. So actually at that area, you're gonna see more of maybe potentially your neck or your cerebellum. The part of the brain that has to do with balance and coordination. Oh, he's going so hard, it's cutting his hand. Oh my gosh. How many of you out there play guitar and have a similar feeling to your hands? The wires are sharp, and could you actually do this to your hand? I guess if there's enough force, you potentially could. If you do accidentally have an amputation of a digit, make sure you bring it to the hospital when you come for an evaluation. Don't put it directly on ice. Maybe a wet paper towel around it, put it in a plastic bag, and then it can be put in like a water ice bath. Oh, bleeding from the sound. Holy cow. Yes, you have the potential of rupturing your eardrums, aka your tympanic membranes. More commonly, we see them rupture when people have a bad infection that's not treated right away. But when you have bad ruptures due to volume, due to explosions, you may need what's called a tympanoplasty, where you actually have a new eardrum placed in that area. Oh no, bad idea. Like horrible. I've had patients come in where they're doing some sort of gardening work and they're using some sort of machinery that flies objects through the air. I've seen people get lacerations, foreign bodies stuck in skin. What? This crazy. Literally the eye connected on the back by the optic nerve as well as the 6 muscles of the eye. And then we have a piece of the brain that's showing. We know that this injury is not salvageable. Nice, get your autograph. Oh. What? Oh my gosh. Could a gunshot wound do this? Yes, sometimes a bullet could go through multiple objects. What are you doing now? Oh my goodness. Holy cow. A lightsaber burns as you cut, so it's cauterizing. The only thing that's really similar to that would be what's called a Bowie knife, which is basically a scalpel that a surgeon uses that also is able to cauterize at the same time. Head injury due to hot liquid poured on it, basically. We see this when it comes to hot liquids from people's stoves or coffees. Typically, you see second-degree burns, sometimes deep second-degree burns that might actually need skin grafts. So just be careful with the liquids that you have. Did you just eat all the people? Everybody is without oxygen. How long can you go without oxygen? Typically around 5 minutes to 7 minutes. You can probably be without oxygen before you potentially would die. Autograph, and he's gonna take his hand off. Getting crushed by massive amount of concrete by weight. It's actually common. It happens in construction sites. You can get compartment syndrome due to massive destruction because of so much swelling. It doesn't allow blood flow to go to the extremity or distally to the injury. Getting stuck to ice. We've all had it happen when we try to grab ice out of the freezer. The issue ends up being it causes ischemia and can cause the tissue to actually die. It hurts a lot. The best way to release yourself is to pour warm water to the area. Oh no, oh my gosh. Ripping the eyeballs out, oh man. You can actually see that there's different attachments to the eye, so that's really good. But could your eyes actually get frozen that way? Unlikely. If you are feeling a little stressed just by watching this, you're not alone. That's where Chillax comes into play. It's designed to help you chill and stay calm through all of life's wild moments. Find Chillax on lifehappens.com or on Amazon and take a breather.
What the?
Having a decapitation through the skull doesn't seem as likely. Typically would not show to the emergency department because it's not sustainable with life. Wow, very simple. We got 3 ribs. 3. We got 4 vertebrae that look like marshmallows. Very simple bones. Just remember, there's going to be 2 bones to the forearm. There's going to be 2 bones for each lower part of the leg and a lot more organs in the abdomen. Make sure that we take good care of our bodies. Oh, chemical experiment gone awry. What is this? Burn or injury to the hand. Wrapping is appropriate. If there is a burn to the hand, we typically want these to be evaluated at a burn center. For your feet would do the same thing. Typically the healing is about the same, but you just need to get it monitored and have a good follow-up relating to that. Oh man, when you touch it, it breaks down tissue. So good job here. We got the tibia and the fibula. Things like necrotizing fasciitis that will eat away your skin. Other than that, just trauma is typically what we see where people have flesh that is gone. Oh, the liquid. Okay, it's gonna eat through it, isn't it? Windshield wipers. Interesting. Why does he need windshield wipers when he can't see? Oh man, that was good. Good meaning a good like depiction. We have in the medical literature where people's faces actually get destroyed off, but they still can survive. You have to put a breathing tube in to protect them because of all the bleeding and airway compromise. Oh Jesus Christ. Nice. We got kidney, we got heart, we got intestines. That is it. Those are the only organs we got. I used to work at a trauma center where so many people came in due to car accidents. So it's a really common issue. Everybody walking out there, please look both ways. Oh no! You're on fire! Run! Depending if it's first degree burn, which is not open skin, just painful red burned skin. Then you have a second degree burn, which could be those blisters. Once those blisters open, that's when you really need to take care of the tissue by keeping it quite moisturized. If you have a third degree or fourth degree burn, these are going to have surgical interventions. Smart. This is good, okay. Stop, drop, and roll.
Stop, drop, and roll, Dad.
Or you get a fire blanket or anything you can do to kind of suffocate it and get it to stop. The burn has already caused the damage. Put ice on it. Well, that's just gonna soothe it for what it already did. Whoa, well, how did they just go up in flames? If you're having that much flame around your face, typically people will get like flash burns. It's not something that's continuous like this. You look at eyebrows, you look at eyelashes. If there's nose hairs that have been singed, blackness in the back of the throat, that gives you a high suspicion that there's something probably impending that's bad relating to their airway. Oh, I wasn't expecting that. Wood, blunt fence like that, hard to do that. I have never seen that come into the emergency department, but I've seen rod iron fences. We actually see people who fall from great heights out of trees, off roofs. Somebody lands on their feet. Oh, that's amazing. But then they fracture a couple bones in their back because the force goes shrink. Oh, constricting because taking away the oxygen, but it wouldn't necessarily constrict because you're still breathing out a little bit of oxygen as well as CO2. Oh my gosh. So that only took a few seconds. Even if you're out without oxygen just for a few seconds, you shouldn't be totally unconscious, so to speak. I can hold my breath for about 2 minutes. I might pass out, but then if I'm still not getting oxygen, I probably have about 6 to 7 minutes before my oxygen saturation curve goes from 100% to 90 and then all the way down. That's hilarious. That's pretty good. Until it's gonna cause a neck problem. What? What the heck? How did that happen? Rips the body apart. That's crazy. We do see my favorites. Classic brain with the gyrate. Classic. And then we see tubular structures of intestines missing the omentum as well as the mesentery. Oh, this is where you push it and get it spinning. Yeah. Oh, it's gonna sound awful. Something bad's gonna happen. There's an airplane taking off. There goes your finger. Ooh, degloved. Degloving, when you pull off all the skin. The skin is the largest organ in the body. Really important. You can't really live without it. A lot of times it's thick enough that you might be able to actually reattach it and still have it function. A lot of times we see the degloving accidents in industrial industries as well as car accidents. Oh! I think it's trying to give CPR. There are instances when CPR is difficult. Maybe there's a lot of vomit, there's a lot of blood. Sometimes there's already a big indention in the chest wall from all the ribs that are fractured due to CPR. Oh! Lots of lacerations. These small puncture wounds probably can be removed. You do have major vessels of the face, especially they come off of the external carotid artery. Oh, good. Electrical fence just hanging out. I love it. Electrical injuries can cause cardiac arrhythmias, VFib, VTAC, burn your nerves, cause cardiac arrest. And how do you fix it? We use more energy again. Could cause rhabdomyolysis, breakdown of the muscle tissue. Really funny is the bone structure. They did a good job. At least with the fingers, you have your phalanx, so you have 3 pieces. That's pretty good for each finger. You know, we're missing a few bones. We should have 2 in the forearm on each arm. We should have 2 in the lower leg below the knee. Oh, the moose. Oh, ah. How many of you out there have pets that sometimes go a little rogue and cause a little nibble? We get people that suffer from animal attack and bites that will puncture in. You probably need to have these wounds really washed out and potentially opened up in the operating room because of the potential of getting bacteria inoculated or basically punctured into the bone itself. If those colorful situations leave your heart racing or your stress levels climbing up just a little bit, Chillax, an occasional stress support supplement by my company Life Happens, is here to help. Find it on lifehappens.com or on Amazon. Oh my gosh. You have ones where the tissue is just so destroyed. Missing tissue, missing muscles, pretty bad. Ripped off the covering of the abdominal wall. The small intestines are all jumbled up, typically in the middle, all attached by mesentery, which is how you get all the blood vessels and the nutrients. They always do depict them as stretchy. They are, because they are smooth muscles, so they do stretch. What is inside of the intestines? Poop, right? It's where our food gets broken down. We absorb the nutrients. We process it more. Oh. He saved the animal. He saved them. Oh. Oh. We got brain matter. We're doing our ABCs, trying to stabilize them. You gotta blow a whistle. You can swallow a foreign object, get it stuck in your esophagus, and feel like you can't breathe because it has this weird sensation, overlapping nerves, and potentially just pushing a little bit on the trachea. But the trachea is solid cartilage. It doesn't go all the way around except for one piece of cartilage, which is your cricoid cartilage. We have foreign bodies into your face. Sometimes you can't get them out of the tissue, which freaks everybody out. If we try to go digging to try to get this out, we may not be able to find it. Oh, and the arrow. Look at this. The arrow compresses the eye, which we call the globe. This actually does happen when you have penetrating trauma to the eye itself. The fluid of the eye starts to leak out. There's synthetics that they can inject into the eye, so that's okay, but you don't want to touch it. Oh, geez. Haircut? Yep. The scissors that a hairdresser barber uses, they are super sharp. More often than not, we actually end up seeing the haircutter or barber come in with a cut on their hand because of the scissors. Oh my gosh, it's a lot of hair. Oh, I will tell you, head wounds bleed like stink. You don't know where the artery is, you don't know where the blood vessel is, and I've taken off bandages that EMS had put on somebody's head, coated with blood. It's almost like a skin graft. Skin graft takes pieces like that. They actually put it through another machine that makes it into a mesh, so it covers more space. Nice. There you go. I mean, that is exactly what we would do in the emergency department, maybe with some gloves on. You wouldn't want to glue this down.
Steri strips, doc.
No, you wouldn't really want to do that either because there's always a chance that they will come undone. With this, you really want to tack it down, so you're going to use sutures. Oh, no. Oh, gosh. Cuts in the mouth, they bleed a lot as well. The whole head and neck area bleed a ton. Here, getting good control of the bleeder is really hard. You'd probably have to intubate them. You have blood all in the airway. Oh, get your bread. So funny. Oh, jeez. Oh, man. Come on.
Come on!
I had a manhole cover somehow fly up on the highway, smash into the side of my car. If it was to hit a person, this is potentially what would happen. Cutting maybe epigastric area, maybe just below the diaphragm, maybe pieces of the lung, and then maybe liver, spleen on each side. Not bad. Oh, If patients accidentally shot themselves in the foot and it gets stuck in the bone, we get an x-ray first, see if it's truly in the bone, and then we just pull that sucker out. It's a puncture wound, increase the risk of different bacteria depending on if it's in the bone or not. Do you need follow-up with orthopedics, wash out in the operating room versus antibiotics and watch? Why not?
Why not?
You're putting it through the foot. It can go right through the metatarsals. Very painful. Sometimes you can get lucky and go in between, but in between each of the bones is your nerves, muscles, and blood vessels. Oh man. I've literally seen patients come in with fence injuries, not like this, but where the fence is impaled in. And you know what happened? They didn't pull it out, which is appropriate. They left it in place and then got to the hospital in a safe, controlled manner. What is this? What are they depicting? Tight roping. I'm assuming the intestines. Oh my gosh. The intestines do stretch a lot. They are a muscle. It can stretch pretty far. So when actually the opposite happens, when it gets cut, it shrinks down a ton. Same with your blood vessels. When they get cut, they just go massive different directions. So they're hard to find the ends of them. Oh my gosh, the teeth are gone. All the gums are gone. You would think that all the soft tissue around would melt into a piece of plastic device, but I guess not. Those are all molars. The molars have multiple roots like that versus the incisors are typically one. There goes the right side of the brain. Actually, sadly enough, when people get into bad car accidents, fall from really tall heights, and they smash their head, you can see brain matter coming out the skull if it's fractured, sometimes out the ears. Whoa. Uh-oh. Zoom. Be careful with irons, just like the guy from Home Alone. You can get smashed in the face. You can cause burns anywhere in your body. Usually people just drop it or trip over the cord. Oh my gosh. Just poked right into the eye. Don't immediately pull this out. It's probably enucleated the eye, meaning that the fluid in the eye is now gone. That's not really repairable. It's more of trying to make a cosmetic repair. That is a massive piece of steel. Based on the colorful stuff around, this piece of metal has ruptured the major vessel in your body, aka your aorta. Oh, butter popcorn. Burns. This is classic. Super common reason why people actually burn themselves is hot liquid that occurs at home. Most of the time it's hot water or like hot oils typically will spill on somebody and then cause the burn. Once the burn happens, there's not really much you can do to reverse it outside of your body healing it. Radioactive symbol. It's been pantsed. Ah, pants, so exposure. Got it. One disaster after another. If these colorful situations leave your stress levels climbing a little, Chillax by my company, Life Happens, is here to help. Designed to help you stay calm and find your chill. If you want to learn more about Chillax, find it on lifehappens.com or on Amazon. Typically, buses don't get in too many accidents, but if you do, usually it's on the news. When we see pedestrian versus car, we have a high index of suspicion for significant injuries. So most of the time, somebody's going to get a head-to-toe evaluation, most likely CT scans, and then any x-rays for the extremities. Oh my gosh, we got like Superman powers. In the trauma bays at the hospital, they'll actually increase the temperature of the area because when somebody comes in with a trauma, it will actually take off all the clothes, cut them off. The patient is exposed, which increases the risk of being cold, and you don't want the patient to be cold. Why are you doing that? Ashes to ashes, dust to dust. Now the radioactive material inside him. Oh man. It's very rare for anybody in the United States to deal with like radioactive poisoning. It's more related to like different toxins that somebody might be exposed to. It's something in medicine that we do differential diagnosis so we can think of worst case scenarios versus what it's most likely going to be. Oh no, bees.
Not the bees!
How many of you out there are allergic to bees? Let me know in the comments if you get stung by a lot of bees. Even if you're not allergic, that's going to lead to an inflammatory response in your body. It's going to cause swelling, dilate things, move things to the periphery, and almost make it seem like you're dehydrated. Oh my gosh, awful. If you are allergic, it could just take one bee sting and set off that cascade of your anaphylactic reaction. First, you get those hives, then you start having facial swelling, tongue swelling. You might not be able to breathe. You might feel like you're having neck swelling. You need to use your EpiPen. Hopefully you have one on you. If not, call 911 immediately. It's the worst. Come on.
Come on!
Stuck. We can't get out of the water. We potentially will be drowning or having a near drowning event. If somebody says that they drowned, that by medical definitions mean that they passed away from the drowning. Holy smokes, a lot to unpack in just a few seconds. If the water is cold, you'll have cold water reflex. Sometimes you can have vocal cord spasm, closing up the airway. When you're underwater, you have to be aware that you're in a fight or flight response. The more you fight, the potential, the more you're burning through your reserve of the oxygen that you have in the tissue. Oh my gosh, look how massive the cord is. Oh. Why are we cold? Oh. Oh my gosh, I know where this is going. This is hilarious. Be careful with heating blankets. I have patients that come in that use heating blankets so often that they actually have chronic skin changes. They are good to bring warmth to tissue. Make sure you do, say, 20 minutes on, 20 minutes off. Make sure you get your body a break. Uh-oh, dial is, oh my gosh, the cord is heating up. I bet it's gonna pop. Oh. so hot. Burning the palms of your hand actually is an indication actually to go to a trauma center, just because the skin is different on the palms and your soles that needs to be addressed by a burn surgeon. They're huge. Oh, they're gonna cause a disaster. Oh my gosh. Look at the brain tissue. Good job, anatomy-wise. Things that are falling out of the sky, even though they might seem to weigh very little, because of gravitational forces, it actually accelerates to a certain point and then can cause a significant amount of trauma. Whoa. What? Yes. Eyes don't pop out as much as they show in all the shows. Majority of the time when we see a lot of eye trauma, it is due to the fact that the eye has been punctured. You have 6 muscles plus the nerve.
The knife.
Things kind of stay intact the majority of the time. Holy cow, this popcorn is destroying everybody. Upper extremities that you see here, you just see the humerus, which is fine. Single bone, so that's good. And then we're seeing the potential of like the spinal cord and some other organs just hanging out. Uh-oh. Railroad crossing, holy cow. Oh! Come on.
Come on!
We got brain tissue, we got skulls, we got jaws, we got ribs, we got vertebrae, and what appears to probably be either like a slice of the spleen, slice of the liver, or even a kidney on either side. Oh my gosh, okay, fast food. Oh, ow, that even hurts my ears. Holy cow.
Oh, my freaking ears!
You can have significant trauma to the ears just by significant volume, something maybe greater than 150 dB, as well as even just frequencies that are super damaging as well. You can have rupture of your eardrums, and your eardrums have blood vessels in there, so that's why you're going to see this bleeding that's occurring. Glass could go anywhere, everywhere when it comes to car accidents. If there are really large pieces in areas where there's a concern for massive blood loss, please don't pull it out. Just let it be and get help immediately. Smudge, smudge. If your nervous system just took a hit from all the woodland creature chaos, you might need Chillax. It's our fast-acting occasional stress support supplement from my company, Life Happens. When adorable gore leaves you shook, Chillax has your back. Grab it on Amazon or at lifehappens.com. Gonna walk right through the glass. We're seeing a significant amount of large pieces of glass. Be careful pulling these out. Certain areas of the body are highly vascular. The left arm, there's a big, huge piece of glass right there, and it could be equivalent to what's called the antecubital fossa. In that area, you have major blood vessels. Very cool. Okay. Oh my god. Your head would not necessarily swell up like that because your skull is a fixed bone. Oh my gosh, we're missing arms and heads here. Maybe appropriate bone, maybe not. Typically in a human, you have your humerus, which is the upper part, which then forms the elbow with the two bones of the forearm, your radius, and your ulna. Uh-oh, something bad's gonna happen. Nope, gas leak. Classic. Toxic gas exposures, interesting. The common ones that we see at the hospital would be carbon monoxide, or a little bit less frequency when people mix chemicals together. Smoke inhalation is one. That's always a concern for, say, like cyanide, just because of the materials that we have in homes.
Killing machine!
Oh my gosh. He got pantsed. And getting exposure to radiation now. Interesting. Classic of like a pedestrian versus car. Most common deadly injuries that we see is traumatic brain injury. That's where we see people with skull fractures, exposed brain material. You could also have significant amount of blunt trauma going to your chest and thoracic cavity, leading to cardiac arrest.
Cardiac arrest!
Oh no. This wood chipper, besides having the whole person go through, we do see potential injuries that occur, usually hands. Majority of the time something got stuck and people forget to turn off the machine. Not just wood chippers, but snow blowers as well, and even lawnmowers. Oh my gosh, water park problems. Jeez. Oh no. Going down a water slide. Who has had an accident in your past? Let me know in the comments. The biggest thing you always want to make sure is that there's somebody watching maybe above and below. That way you don't run into somebody, and that the water is flowing. Make sure there's enough lubrication, because otherwise you're going to get skin burns, and those actually burns are awful. Cutting somebody in half doesn't actually happen. We don't see it very often. If somebody is cut in half, the 99.999% of the time, it's due to a traumatic injury relating to probably high-speed vehicle or big heavy machinery, and they're usually dead on the scene, unfortunately. What's the accident that's happening? There's the decreased water. No, don't go. Yeah. Oh, ouch. I can just imagine those burns. Hopefully not so deep that you won't be able to heal. So how do you treat these? You treat these like abrasions. And so abrasions are treated with wound cleaning, soap and water, and then topical ointments. So you can use, if there's no infection, Vaseline, Aquaphor, those sorts of things, and bandage them. Oh, got a little sugar. What? Oh my gosh. I think we're missing an arm. On the left upper extremity here, your first part is going to be your humerus, and then below the elbow is going to be your ulna and your radius. When we see two bones here, it doesn't make sense because it just should be a single bone up at your humerus. Oh.
Stop it. What the heck are these costumes made out of? Slicing a face off. I mean, they have done face transplants before, but I've never actually seen somebody's face totally come off. I've seen partial degloving of somebody's face, but not totally removed. They were able to attack it back. Oh my gosh. You're seeing here the skin is gone because we're seeing striations that are similar to what you would see in the normal muscle tissue. And it's so cool because they got it right around the face. You have all the different lines going in different directions. That's why we can like squint our eyes because the muscles are circular. How cool is that? You got to be really careful with this type of like material. If there's like vinyl, they'll go up in flames pretty fast. And then what ends up happening is that smoke, the plastics, leads to toxic chemical exposure, smoke inhalation, and then you need to be treated with emergency medications that EMS has as well as in the ER. Whoa, whoa, whoa. Strangulation. Wow. Strangulation and injuries do come to the emergency department for many different reasons, accidental, on purpose. And so we worry about airway, worry about the airway. Is the airway compromised? Do we have to worry about swelling of the airway? Then you also worry about the blood vessels on either side. Well, there you go. Running over people, which is quite common. The amount of pedestrian versus vehicle injuries that we see is immense. Here we have traumatic brain injury. The eyeballs are popping out and we're seeing brain there. But if somebody is still alive, they will probably still be brought to the hospital. But with this amount of brain trauma, the likelihood that they show up to somebody on scene alive is pretty low. Oh, geez. I have seen multiple people with horrible outcomes when they've gotten out of their car to do something. They're close to a road. Cars are not paying attention or they're too close and hit you, hit the vehicle, and loss of life, loss of limb. Oh, the classic slide. Oh, man. Me and Jen talk about this all the time of like, wait a minute. Who let us go down these slides that were metal, that were roasting in the sun, super hot, but ouch. That's going to leave a mark. Oh, geez. Be careful when you trip people. Literally, a human body, when it falls to the ground from a standing position, if you are not protecting yourself and you're just dead weight falling, it's actually really bad and there's a lot of weight to it. And so you could actually crack your skull open. No, your brains typically won't just fall out. There is connective tissue all around. Oh my gosh, remember Home Alone when he lit up the handle and then he grabbed it and got the M from McAllister on the hand? Palm burns are so uncomfortable. The tissue is just a little bit different. Same with the bottom of the feet. Thicker skin to that area and then just really difficult because you're using it so often to live your everyday life. Whoa. Uh-huh. Whoa. So you got to be really careful. People use generators inside their house or like burn coal inside their house. Please don't do that because of the fumes that form and increase the risk of carbon monoxide poisoning. And you can pass away because carbon monoxide is tasteless and odorless. Oh, nice, like a soapbox derby. I've never done one of those. Oh. I've seen a lot of fires in cars when I'm driving by. Nobody's in them, but never actually seen it happen in real life. Has anybody seen a car explode in real life? Let me know. Same treatment, you know, get the person to safety, make sure they're scene safety, get the person to the hospital, airway, breathing, circulation, you make sure the lungs are okay. Oh my gosh, there's still a steering wheel. Oh my goodness. Traumatic facial injury, but the rest of his body is gone and the intestines just come dropping out. When people have surgery and they do remove like lower organs, things actually do shift a little bit and change and fill spaces or voids. So we do have to be aware of that when somebody comes in, they have previous surgery and they're telling us where their pain is. They might have had surgeries that almost relocate the different organs. I like the music. Frying butter? Deep frying, it looks like a stick of butter. It's probably not the healthiest thing for you to be doing. Oh, I see. At the hospital. I like how the doctor at least chained up his bike in an unsterile way.
Okay.
Oh, man! What the heck? Surgery for your heart. One, you should be asleep on a ventilator so you don't feel anything. You do need to make an incision down the sternum if you're doing an open heart surgery, typically called a CABG, where you're using new blood vessels, usually harvest from your own body. Then you bypass where it's blocked. What? Come on, that's messed up. You're causing traumatic brain injury just to knock somebody out. That doesn't exist. Jeez Louise. What is he doing? Just shoving his arms and hands right in there. Okay. Of course he did. He doesn't have a heart. Ripping the ribs open. Okay, so you see some sharp edged ribs. You got to be careful not to hurt yourself and lacerate yourself on sharp bone. Okay, I like this. I like this. It's pumping. Okay. Okay. He still needs a heart. He just don't typically have organs just laying around in the refrigerator outside of an operating room. Hearts are typically fresh because you don't want the tissue to die. With that heart, you need to get it from somebody else and it's couriered, typically on ice, and needs to be put back into somebody else's body fairly fast so then you can get blood flow and repump. I think that's a little bit of a biohazard problem. What is that? Did you go to the butcher? Oh my gosh. It looks like he must have went to the butcher. He got his meat nicely wrapped. And of course, we got a heart that's on a sandwich that he already took a bite out of. Forget it. It's already gone hard. I'm just going to continue to eat it. People actually do eat organs. So most of the steaks that we eat is muscle. A heart is actually a muscle. You do have to be careful eating too much of an organ. Our bodies typically can't necessarily handle it so intensely. Small pieces of it you can. What is this? Trash out here. All right. It doesn't even make sense. Doesn't even make sense. I love how the doctor's like super proud. If you have these big massive hearts, you typically don't want to transplant them because they don't function as well. Too big of a heart, too strong of a heart actually doesn't squeeze the blood out as well. Okay, all right. So we got a blind doctor. With a big syringe. Yeah, I don't think anybody wants a doctor that can't see 100% to try to come at you with a needle. Oh, get another try. Oh, don't do that. Don't do that. Oh, what? This is like torture. Don't just keep jabbing, stabbing somebody, right? It needs to be sterilized. And you never actually go in like this. It's a delicate procedure. You go at a very shallow angle because the veins are just underneath the skin. Oh, it's still happening. It's just... And it's bending and breaking? What? There's no way that you can change direction when you're in there. The needle's gonna snap. And now you have a snap needle inside the body. To be able to get those out if it's embedded, you need what's called fluoroscopy, which is a continuous x-ray an interventional radiologist or a surgeon will use to try to find the needle to get it out. Oh, be careful with this axe. Oh no! Oh! Whoa. How'd that not get him? Oh, the foot. With this type of injury, you gotta be careful or worry, so to speak, for one, it's a dirty wound now, so open fracture, laceration. And then the problem is, can he actually get out of this situation? Okay. All right. That stinks. That was a good idea to think about using the axe to break the piece of wood. But then wouldn't you think that if you broke that piece of wood that the tree's now gonna collapse on top of you anyway? Okay. All right, what's in the pocket? Oh, I told you! This is, oh my gosh, I can't imagine the pain. Oh my gosh. Okay, it's a cartoon, but think about this in real life. So you're using a spoon to cut through your leg. Like that takes a lot of force. Now you have all the tissue is gone in the area. Now you only have bone. And obviously the spoon is not working. So it's getting to a rock to see if we can break it. Oh, that's not gonna work. Just smash it with the rock. Oh, it's split down the middle. Oh my gosh. Splintered the bone with the spoon. Can this actually happen? I think you'd actually have a better chance of just actually smashing it with the rock potentially, or me causing a little bit of damage with the spoon to cause a break in the bone itself to then be able to snap it open. Let's go. I hope he did the right leg. And he chopped off his wrong leg. All right, got the EKG going. Got some infusion. Looks like these are blood infusions. Oh! Darn it. Actually, in real life, it needs to be verified by 2 people before giving it, as well as making sure it's the right person, making sure it's the right blood type. That way you don't have errors. We need to double check ourselves. And obviously, you need to take a lot more care in trying to what we call spike the bag, so you just don't waste blood like that. Oh, okay. Went into like VTAC real quick, maybe VFib, and now it was in asystole. Immediately when somebody goes into asystole, the monitor goes flatline. The first thing you do is check the patient. So you want to check to see, is it an error in the machine? So did a cord come off? Is the machine broken? Is the patient actually still talking and alive? If not, immediately call for help, start CPR. Creature didn't do that and looks like just stabbing emergently into their own arm. Let's see what happens. Ah, there we go. Woohoo! I love it. Now, the creature here decided to stab their own vein in hopes of siphoning their blood directly into the person. We see this in TV shows, movies, cartoons, all different things. I've never seen this in my practice of medicine in the hospital. But I've actually never been in the field in the sense of like warfare. You can't just give somebody your blood unless you're compatible. This could work in very rare situations. I've just never seen this occur. Oh no, we know where this is going. Okay, slicing the lime. A nail. Busted nail. Oh man, come on. You're gonna have maxillary injuries. The nose is gone, right? The first part of the nose is cartilage. Soft tissue is gone at least. Teeth are gone. The mandible is probably fractured. What the? Oh, and then you put some lemons right into the, that's gonna burn if it doesn't already hurt already. Oh, it stings. At least maybe, is it getting clean? Probably not. Probably dirty because bacteria in somebody else's mouth. Now the question is, if you can find the piece, if it's all whole, it might have enough vasculature in that tissue that you can just put it back on and it actually might take. Oh my gosh. Go to the hospital. There goes your finger. Oh, not again. Oh, man. Right to the side of the head. Got to be careful. The side of your head has something called the middle meningeal artery on the other side of the skull next to your brain. That could bleed and that can cause a bad epidural hematoma, and then you get a lucid interval and then you could potentially die. Got to be really, really careful. The eyeball doesn't fall out like that normally, okay? The eyeball is attached by 6 muscles plus your optic nerve. It's not moving. Oh, nice. Gonna slice the eyeball right open. Oh, gross. I love the depiction. It doesn't look like that at all. The eye is super highly specialized tissue and it's mostly liquid. There's the vitreous and the aqueous. It's all fluid, but it keeps the structure of the eye, that sort of thing. Depiction looks like a piece of fruit. The eyeball doesn't look like that. Oh my gosh, come on. You got bloody lemonade. It's so gross. Please don't drink that. Please don't drink that. Please don't drink that. Oh, gross. Blood does not taste good. If you've had a bloody nose or anything like that, it's like metallic-y, gross. That's gonna make you vomit. It's like noxious to your body. Ugh. Oh, look at it. It looks like a little pineapple wedge. Disgusting. All right, where are we at? Washing the hands. Okay, we got good hygiene. No gloves. Okay. Just get a new box, man. Just get a new box. Oh, that's disgusting. So that's supposed to be like a biohazard symbol, like things that are soaked in bodily fluids. Yeah, bad. Careful, you'll stab yourself. Oh, there's organs now too. Oh my gosh. Happy, dirty, disgusting glove. Wash it, man. Dude, I don't know what you're doing. Oh, you're going to the eye. Oh my gosh. Oh my gosh. A lot of times people will actually come into the ER with either like a broken contact lens or they can't find it. Nice thing, we can stain the eye itself so we can actually see the contact a lot easier. 360 degrees, right? And it can kind of sneak in the back a little bit. And we can just take them out pretty easily. Perfect, you got a good contact in, nice. You gotta really be careful of like corneal abrasions, that sort of thing. Corneal ulcers hurt like hell. Usually it's treated with pain medications and topical ointments and they feel much better. And yes, we always wear brand new clean gloves. Oh, nice. Full body decimation. So there are people that go around the hospital try to cheer people up. There's a hospital I used to work at, had the best, coolest Bernese mountain dog that would just roam around, was super loving and always make people feel better. It's awesome that this hospital is trying to make people feel better with maybe a mime. Definitely a mime. Oh no. Oh, it's stuck in the fan? What is happening? Oh! Oh man, snapped a bone in the leg. That's awful. I mean, what's the bandages for if it's not keeping things in place? Oh no, oh no. Oh. Alcohol. So I'm assuming that's alcohol. Alcohol burns. You're trying to clean the wound. Hydrogen peroxide doesn't burn the wound and it actually helps break down like blood clots. It's good for cleaning the wound in the first 24 hours. After that, because it cleans good cells and bad cells, it inhibits wound healing. You gotta stabilize it. There you go. Put it back together. Woo! Call the doctor. Put a splint on it. Oh, cut it. Cut it. It's just come right off. Oh my gosh. It's like a deer in headlights. Like, what are you doing, mime? Like, stop the machine. Like, help. I've seen a lot of injuries, not like fan injuries, but like saw injuries where people's limbs are like sliced off. Never like this. This is like sliced off in sections, almost like a CAT scan machine. Look like every centimeter, a piece is being sliced off. And now we're having like these wheels of tissue everywhere. What the? Yep, a little PTSD. Whoa. What? You're getting a slice through the neck. You're having major blood vessels in the neck. You have your internal and external carotid arteries are still in your neck. You have your jugular veins. It bleeds a lot if you miss or if you poke holes in it. You're slicing it open. You're gonna die pretty fast, especially if you're going both sides. Now, could you take a knife and slice through the bone? Unless you're Rambo, probably not. Oh, he's got a, oh my gosh. Oh my gosh. Let's just throw a grenade inside and the body explodes and he is parachuting down. Maybe free falling. I hope he's got a parachute. Oh, he's going from plane to plane. What? He just grabbed the propeller with his bare hands? Yeah, unlikely. He's gonna slice his own hands off. Come on, and then the strength to rip it off. The thing's flying through the air. It's gotta have the structure to stay on to withstand a lot of wind and a lot of force. So it's just not being ripped off by some crazed psychopath over here. Oh my gosh, this guy is like mass destruction. We'll take a pause for a second. The eyeballs came out, but they're still attached because they're attached by all the muscles and the nerve. Very good job. Oh, so cool. That was awesome. Now you just have the skin, which the skin is the largest organ of our body, is still stuck on the airplane. Look at this person. Oh, he does have a parachute. See? Safe landing. That is crazy. Oh my gosh, like alter ego. Oh, it's like an amusement ride and he just went nuts. Oh geez. Oh, I hate when that happens. What the? Oh! What? If that actually does happen, right, the major blood vessel that's coming down is your aorta in the abdomen. And if that just gets opened up, you can't stop it from bleeding. You're just gonna bleed out in a couple of seconds and you're gonna die. Then, of course, you have your spinal cord that's severed. The bottom half of your body is gone. No, wait a minute. Nice, that's so disturbing. Holy cow, okay, this is disturbing as you could get. It looks like a piece of ham. Could this be survivable? I guess if you're able to stop the bleeding, you're able to survive a little bit longer, obviously. But then the question is, what organs are injured and is it compatible with life? I'm assuming he's blind too, so he doesn't always, I don't understand. Is he blind or driving blind? Oh. How many times has somebody done that? Just leaking out. Now you got a trail of blood. You have a trail of fire. Oh my gosh, come on. It doesn't work that way. Impaled into the abdomen, come on. There would be a lot more fire extinguisher injuries than you've ever heard of, but typically you don't, and it's spraying a powdered mist that's a fire retardant to get it to stop. Oh, and the car explodes. That's messed up. You see the explosion, it takes apart the abdomen, and now you have intestines that are just rolling around. And so the intestines look like this like tube, but it's attached by all this mesentery. So it actually is still in a big formed ball when it's in your abdomen. It kind of comes out like a little bit of a fan versus just these like strings. Oh. Oh. That's just mean. What the heck is that? You don't do it with a full cup of hot coffee. Now the animal has like either a first, second, third, or even 4th degree burn. So we don't know what degree of burn. So 1st degree burn, it's like a sunburn. It's just a superficial layer turns red. 2nd degree burn, there's 2 different types. There's a superficial versus deep, but that's when you get the blistering. Then you have 3rd degree burn, which basically burns through the capillaries and the nerves, which will then end up meaning a skin graft. And then if it's 4th degree burn, it's going all the way down into the subcutaneous tissue, fat, and muscles. Pretty bad situation. Oh. Oh! Oh, nice. Oh man, bleeding out of the ears. So you can have a rupture of your TM or your tympanic membrane or what we call the eardrum. You might not have good hearing as well after. Sometimes you can have a perforated eardrum and it's fine and it heals up well on its own. Other times you need a tympanoplasty where you actually get a new eardrum from yourself actually. You can use a piece of fascia and they put it right on there. Oh my gosh. Oh, come on. When you're using the otoscope, it shines light into the ear canal, the external auditory ear canal. So that way you can see the tympanic membrane and see if the canal is swollen. That's pretty much all you're going to see. You want to make sure that there's something called the cone of light, which is a reflection of light off the tympanic membrane to make sure it's intact. Oh, tuning forks. Nice. All right, I could hear. When I was in medical school and in training, we used tuning forks. We don't typically use them too much anymore, but the point of a tuning fork is to hear if there's bone conduction loss versus neurosensory loss, having to do with you tap it, you hear the noise, and then you can actually put it on the bone to see if you're having conduction. Ah, you can hear better. Nice. It has just a larger diameter so you can take in more of the noise so you can pretty much try to amplify it. Now you have hearing aids that can amplify your noise, and then even then, some people who have no hearing, you can get cochlear implants. If you've ever seen somebody with like an electronic device attached to their head and they can help them hear. I love this candy squirrel. Oh. Oh. Oh man, I thought it was a broken tooth, but it is a fractured jaw. That's crazy. Typically, the only times I see a fractured jaw is trauma from like getting punched in the face or car accidents. And usually you're broken in two places because the energy goes in one place and it needs to go out the other. And sometimes, of course, you get dental injuries as well. Or sometimes we get avulsions where the tooth is gone. Remember, if your tooth falls out and it's an adult tooth, two things that you can do is either put it in a glass of milk or just put it back in your own mouth. And typically we can just shove it right back in there and then we'll do a dental splint and then get you off to the dentist to make sure that it stays more permanently. Ooh. Oh yeah. Pliers. Woo. Yep. So why the heck do we wire a mouth shut? It's like a splint or a cast for a broken bone. You want it to set in one spot and not be able to move it in different directions. And then they actually give you a set of pliers so you can actually break through it if you get sick or you need to vomit because you won't be able to get the vomit out. Oh, people hate it. Yeah, look at trying to use a screwdriver to open. Oh my gosh. This squirrel has a horrible sugar addiction. So sugar is a type of carbohydrate, right? Simple carbohydrate. And our bodies crave it. So if you have it, you're never satisfied. You always want more and you want more and you want more. Oh, oh no! A tongue laceration. Actually, amputation. Holy cow. If you have an injury to your tongue where it's bleeding, it bleeds so much, profusely, hard to control the bleeding, and it's just like all coming out. Yep. It's like a helmet. Oh my gosh. With a lock. That's horrible. I've never seen one of these. We have this thing called the halo, which gets screwed into the skull for somebody who has a cervical fracture. I've never seen this device for a jaw fracture. Oh. What the? It happens. Oh my gosh. What the? Your eye has multiple muscles and then it's connected in the back by your optic nerve. So it's probably the optic nerve that we see hanging out here. But the skin is gone. You don't see any of that. The nose is gone. Holy cow. What is going on? The intestines are very stretchy, right? So the intestines are actually made of muscle and muscle stretches. So it wouldn't rip typically. It could at some point, it's going to rip with enough force. It also potentially wouldn't necessarily strangle you per se because it's so stretchy. But if you have enough force, it's going to do that. This is ridiculous and scary. Oh my gosh. Hiding inside the sleeping bag and now threw it in the fire. This is a horrible scene.
Normally the steering wheel would not do that. It would typically actually could bend. A lot of times people will get spidering of the windshield if their head hits the windshield. What the? Bottom half of his body falls off, rips out. That doesn't happen. But the anatomy looks so good. What we see hanging at the end of the clip is the stomach. That's the shape of the stomach. And it's most likely attached to the esophagus still. The esophagus attaches to your stomach. And then from the stomach, it attaches to your small intestine. Basically, the first part of your small intestines is your duodenum. Okay, we all know this is not realistic. But could you actually survive your duodenum being separated from your stomach? Yes, if you have a surgeon that can put it back together. Depending on the accident, a trauma surgeon would need to see versus a general surgeon versus both being in there. Typically, a trauma surgeon is also a general surgeon as well. Nice! Candy coin machine. I don't know if they have these anymore. I don't know how sanitary they are, so to speak. Do you even know what this is? Let me know in the comments. Oh, there you go. Now you got to be careful not to eat any shards of glass because they'll cause significant laceration in your mouth. Once they get into your stomach and your intestines, if they're small enough, they actually probably won't cause a laceration. Oh, jeez. We get a lot of people that come to the emergency department swallowing foreign objects, screws, nails. If it is in the stomach and it's too large to pass through the intestines, a gastroenterologist will actually come into the hospital. You'll be admitted and you'll have an upper endoscopy done to grab it out of there so it doesn't cause a bowel perforation. Oh! Ah! A lot of broken teeth. We call those like dental fractures. If the tooth comes totally out and you have the tooth, we can put it back in place if it's within 90 minutes. If it's just a chip, we can just cover it with the different types of epoxy so it doesn't cause laceration. Come on. Oh. Don't know where all his teeth have gone. If you can find the teeth and they still have the root in them, you want to either put it in milk, Hank's balanced salt solution, or just in your mouth and bring it to the hospital. Oh, look at this. Appropriate laceration repair. You have suture, which is like the nylon material, or it could be of the absorbable kind, versus steri strips, very sticky type of material that can approximate wound edges. Oh, stop, drop, and roll. Don't be running around like that. You can even use that carpet / rug that's there. Somebody rolls that around you to just smother the fire. That's good. See, somebody wrapped the tablecloth. Oh! Stop screaming. The screaming is going to bring the flames into your mouth, which is going to burn your mucosa, which then you're going to potentially have swelling of your airway, and then your airway is going to close. Just open the doorknob. Oh my gosh. An axe to the head. We do see these occasionally. They usually cause blunt trauma with a laceration to the superficial tissue, skull fractures, and they get wedged in just like they would with a piece of wood. Now, if that does happen, don't take it out. Get to the hospital ASAP, and then they'll take it out there. Oh my gosh, come on, the ladder falling and splitting the body. Very interesting. We're seeing like the brain tissue, super cool. A couple teeth, you see the tongue. Oh no, the gas gauge. Just siphon and put gasoline on the fire. What was that?
What the hell was that?
That just went through the back of his head, taking the brains out. Do we have that much blood pouring out the back of our head if it actually opens up? Not that much. It actually does have blood, usually related to a little bit around the brain, and then also the skin, the muscle, the fat. Yep, there you go. So there's something bad was in there. Oh my gosh. Give me something straight into the head. Yep, foreign body into the eye itself. Don't remove it, leave it, stabilize it, get somebody to the hospital. You'll have some bleeding.
We got a bleeder!
But if you remove it, you're gonna lose all of the fluid in the eye and it's gonna drain out super fast. And you need to see an ophthalmologist to fix the defect and make sure that you don't have any major structural injuries. Oh, a little mouth to mouth. Oh my gosh.
Oh my gosh. If you're doing rescue ventilations on an individual, it's not just going in the lungs, it also could be going down the esophagus into the stomach, causing gastric distension, and the belly just gets huge and big. So when we end up intubating somebody, we actually put a tube into somebody's stomach so you can actually decompress it. Oh my gosh. So people will come into the emergency department and say, hey, I'm going to explode.
I feel like I'm gonna explode here!
I've seen some really distended intestines in my life and they haven't exploded. Trying to do the look, listen, and feel, see if somebody is breathing. So you look to see if their chest is rising. You put your ear and your cheek to the side of their mouth to see if you can feel air movement or hear air movement. When people come in with visual changes, we ask if you're having double vision versus blurry vision. Typically, if it's two images,
I'm seeing double here.
that means your eyes are just not working together versus blurry vision. There's other factors that are involved. Oh, bleeding out of the ears. When somebody bleeds out of the ears, you think about ruptured tympanic membranes, aka the eardrum. And then you always worry about something even worse where you're having like brain bleeding. Take the headphones off if it's too loud. No.
Nope.
Too loud a volume of music to your ears is going to cause ear trauma, damage. Damage to the receptors, to the nerve endings. Is it going to cause you to explode? No. Could it cause enough pain to your ears? Yes. Holy cow, what the heck? The heart looks pretty good. I mean, the vessels are kind of wonky and all over the place. They don't really look like that on the outside of the heart. Did a good job of the other attachments. Oh my gosh, try to shove it back in. Oh, we got kidneys. We got a kidney that maybe looks like a stomach. I don't know what the white looking potato organ looking thing is supposed to be. Got the heart coming back out. What a bad mattress. That's all I gotta say. Lasted a couple seconds without the organs in the body. Just what I said. They did a good job, at least on that. Oh my gosh, that looked disgusting. It's either sewage coming up, bad diarrhea, I don't know. Sometimes if people vomit a lot, you can get the bile to come out. And some people's bile is green, some is yellow, some is brown. Just depends on the individual. Sometimes when you're hyperventilating, you're blowing off way too much CO2. The point of the bag is actually to keep some of that around to rebreathe it. Otherwise, you're going to either pass out or you're going to cause a significant amount of muscle cramping and spasming. Oh, so gross. That's not how you use a plunger. There's actually this type of mechanism in the United States called a Lucas. Basically, it's a device that actually has a plunger suction cup that compresses down onto the chest, and the machine actually will do the CPR for you. Or a bird. Oh my gosh. We got some gluteus maximus.
Maybe just one glute?
Muscle striations that you can see. All different types of glute muscle tissue. Bite wound from an animal, you're definitely going to cover with antibiotics. Typically, we use Augmentin here in the United States, which is amoxicillin and clavulanic acid. Oh my gosh. Ripping of the forearms. What? Oh, the skin just came off. That is a total body degloving. Removal of the skin. Depends if it's a thick enough removal and total removal of the skin means it still has its own blood supply. So there's a potential that you can reposition it, put it back in, sew it back together, and it reattaches.